correct?
Yes.
So same thing, you just come in and identify which system you're working with. I'm going to drop your gown for you here. Respiratory, I always tell people to actually take another step back when they're looking. It helps you evaluate for symmetry. Again, I'm looking at, while he's breathing very easily, I'm looking for any use of accessory muscles. If he's making any noises on inspiration or expiration, I'm looking at distribution of muscle tone, and actually it seems to be that on his, are you left-handed?
Right-handed.
On his left side, either it's the way he's sitting, but it appears that this muscle here may be a little larger as well. Distribution of hair is even. Other than the mark I made there on his chest wall, there's not much there. As well, no heaves. I don't see any inversion in his rib cage as well. Posterior to, and you would do the same thing posterior to just examine his concavity of his rib cage. So here I would be looking to make sure his spinous processes are aligned and that they're straight. Again, I see very small nevi, seem to be evenly distributed. Nothing really that I would measure or note or have the patient follow up on as well. The symmetry, and there's one more thing back here. Symmetry of his clavicles is the other piece that you want to look for. If you could round your chest out a little bit. Actually forward. If you're having a hard time seeing someone's spine, that's another technique that you could have them do in order to assess whether it's midline or not. That helps, have them do that. And then you can just relax, huh? The second piece is to look for the scapula, and in the front you'll actually make sure that the clavicles are even. Posteriorly, you're looking for the scapula to be even as well. If you see someone that has scoliosis a little bit, maybe when the girls do, you may see that one is a little more upright than the other. The next particular piece is that you want to know the anterior and posterior diameter, and we've talked about that a little bit, and you want that to be 1 to 2. That's the only question I would ask you guys about that. I'm not going to ask you how you measure it or anything. I just need you to know what that diameter will be. And then actually what we're going to do is just kind of palpate around, and after that, and I'm feeling for any tenderness or any masses as well. Then I'll just walk back up, and then I'll have him say 99.
99.
99.
99. 99. 99. 99. 99. 99. 99. 99.
What should happen tactile firmness wise when I go from the top to the bottom?
Decreased vibrations.
Decreased vibration. That's the only question that we would ask you there as well. Take a deep breath in and out. Deep breath in and out. So on symmetrical expansion, you just want to note that, so you take a deep breath more often.
Yeah.
That the movement of your hands is even, moves freely without difficulty to the patient. You could even know patient coughed upon completion of symmetric excursion, symmetric expansion. So that's all you want to know. You may have, if someone has either had surgery or has a pneumothorax, you may see that would not be even. So that might be a question. It's like maybe when's a time where you might see in a patient where symmetrical expansion is not even. Then percussion, you'll want to percuss in your, if you remember, you have your 3 landmark areas for percussion here. And you can either do 1, 1, 2, 2, 3, 3, or you can do all on one side, on the other. Jarvis does give you a way to do it where you're going side to side, but that I'm okay either way. So you'll cover all 3 here. Practice your percussion. It's okay if you're having a hard time with your sound, but what you want to do is make sure you got a good contact when you're doing that there. So, I had more dullness when I got over the visceral organ area is what you would want to be able to know on percussion. We would move to the anterior. I stayed posterior because I was already here. We would then move to the anterior side and do palpation and tactile fremitus, as well as do percussion. If you remember, on the anterior side, you will not have as many landmarks as you've had posterior. Remember, posterior landmarks, you have 9. You've got your 3 across here that count as 1. And then you'll move down through here, and you've got your additional 2 through 7. And you've got 8 and 9. 8 and 9. Okay, so those are your posterior landmark areas. If I wanted to test, say I'm about to auscultate, and when I auscultate, I hear I hear rails. What's a test I could do for adventitious breath sounds? Anyone want to speak up? Radigophony sound familiar? Bronchophony? Don't sound familiar?
Yeah.
It should sound familiar, okay. So if I'm testing for egophony, what's a normal test? Like, what should I hear if I'm having him say E? Will it sound like E in my stethoscope, or will it sound like A?
E.
Who says E? For a normal egophony.
For normal, you have to hear A.
A.
A to E.
Okay. So you guys need to know those tests, because I'm going to ask. I can promise you, you'll probably get 2 questions regarding that. There's 3 tests that I can ask you to perform. Okay. So same thing in terms of auscultation. Deep breath in and out. 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 Deep breath in.